What's going on, guys? It's your boy OG Dre and your boy Cisco.
What up?
And yet, welcome to another episode of the Canna Manifesto. Now, I want to jump right in it because we got some really awesome videos to share with you guys today. All right, so the first guy that we're going to be talking about, we're going to see Steve Cohen. Steve Cohen is going to be destroying, ripping a new a-hole to Michael Botticelli.
Yeah.
All right. So Steve Cohen is being selected into Senate since 1982. All right. Right now he's representative for Tennessee District 9, serving his position since 2007. You know what I'm saying? He's an old dog. He's been around the block. He really achieved a lot of stuff. You know what I mean? To not, you know what I'm saying, jump in a whole bunch of details, please, here is how you rip a new a-hole to Botticelli. With Botticelli, who is Botticelli, real quick?
Well, Botticelli is the acting director of the White House Office of National Drug Control Policy.
All right. No.
That is what he does. He lays the law.
Now let's watch his a-hole rip.
But it is ludicrous, absurd, crazy to have marijuana in the same level as heroin. Ask the late Philip Seymour Hoffman if you could. Nobody dies from marijuana. People die from heroin. And every second that we spend in this country trying to enforce marijuana laws is a second that we're not enforcing heroin laws. And heroin and meth are the two drugs that are ravaging our country. And every death, including Mr. Hoffman's, is partly the responsibility of the federal government's drug priorities for not putting total emphasis on the drugs that kill, that cause people to be addicted and have to steal to support their habit. And heroin and meth is where all of your priorities should be. Anybody that goes to jail for marijuana is a crime when people for possession are taking their liberties away. It's a waste of money. It's a waste of resources. It's a crime committed by our government. There is a cultural lag in this country, and this Congress is a leader in it. With all due respect, you should be listening to scientists. I understand the parents who are grieved because their child died of an overdose. They didn't overdose on marijuana. And you're listening to them rather than the scientists? Mr. Botticelli, it may go back to A Few Good Men, the movie, Jack Nicholson. You can't handle the truth. The truth is the drug war failed. Your direction on marijuana is a failure.
And this is just the beginning of this video, right, guys? You know what I'm saying? So far, Cohen has brought up some really, really interesting and very awesome points that made literally Mr. Botticelli choke. Like the whole time he was just choke. You know what I'm saying? One of the things that really caught my attention is we're really not bringing the emphasis on the drugs that are really affecting the community. You know what I'm saying? So it's such as, you know what I'm saying, prescription medications, crack cocaine, you know what I'm saying, heroin, like really things that are really damaging our communities. We're not really putting emphasis on those. It's just like we're not really teaching the kids about the real drugs, you know what I'm saying? So it's like, I think that's one of the biggest problems, you know what I'm saying? Also, we're talking about spending largest amount of money on resources trying to stop people from getting their medicine like cannabis, you know what I'm saying? We're the leading country in like, you know what I'm saying, like incarcerating, you know what I'm saying, by capita, you know what I'm saying? 750,000 people a year, bro. You know what I'm saying? Another thing, I love it when he says, you can't handle the truth. You know what I'm saying? It's like, you literally calling these people out. You know what I'm saying? Yeah. So, without further ado.
What percentage of your budget goes towards heroin addiction?
So I don't think we necessarily slice our budget, our demand reduction budget, based on drugs. Again, our prevention efforts are focused on preventing drug use.
Isn't that a mistake when people die from heroin in great numbers that the Vermont governor spends his entire state of the state on heroin use? And we don't distinguish and try to save people's lives. That's when you knock people over at the corner store. It's not to get money to buy a donut because you're high. It's to buy heroin because you're hooked. That causes people to die. That corresponded back in 2011 with I guess your predecessor, Kirliowski.
Kurlikowski, he's actually the current director now.
Is he? He said back then that that there was no particular, they haven't found any medical use. To date, however, the FDA and the Institute of Medicine have not found smoked marijuana to be a safe or effective medicine for any condition, nor has any medical association came out in favor of smoked marijuana for widespread medical use. I think that medical associations have, but are you not aware of the fact that people use smoked marijuana to get them through cancer treatment, nausea?
I do, sir, and it's never been our office's position to either to arrest people who've been using medical marijuana. I think it's important for us, and again, unfortunately, that the FDA is not here. You know, that it's the FDA process that ultimately determines the scientific efficacy of a.
But couldn't you try to influence it? Shouldn't that be part of your job? I had a buddy who was a SEAL. He died of pancreatic cancer. So when he was he smoked marijuana at the end. His mother said it's the only thing that makes oral smile or eat. So that was pretty good.
So our role in this is to rely on the FDA scientific process to determine. That's our influencing role, is to rely on the science. I would also say, and I find it unfortunate, and I think I would ask the chairman to invite Dr. Nora Volkow, who's the director of the National Institute on Drug Abuse, because that's where our policy and our science is derived from.
I mean,
it's kind of dumb. But moving on, like what he just said at the end, he just said all his statistics, all his information comes from Nora Volkow. Mm-hmm. And it was unfortunate she wasn't there.
But, and not to mention that he calls out the FDA too.
Yeah,
you know what I'm saying? Apparently the FDA, check the pip game. The FDA came out and said that there is no medical use, there is no safe or effective way to use medical cannabis. What is it called? And he also says the FDA is in that they go by the FDA in the scientific process that they use. So if the FDA chooses to go by this doctor, which is, her name is what?
Nora Volkow.
Nora Volkow, something like that. Let's just hear this. And one of the things that you guys got to keep in mind is that this lady focuses her studies in people under 18 years old. Okay?
If she wants to work for the school board, get
Exactly.
a job with the local county, you know what I mean? Don't be giving the FDA a bunch of stupid studies that are relevant, you know? And maybe, I don't know. It doesn't make sense to me, but you make your own opinion. Let's put it on. Let's throw it on.
Perfect.
And this data, which comes from monitoring the future, contrasts to measures in 12th graders between their past month of tobacco versus their past month of marijuana. And what you see is exactly what we are facing, a significant increase in marijuana use among young population that is epitomized in the contrast, our very good job vis-a-vis decreasing smoking among young people, so that for the past 3 years, the rate of past month marijuana smoking is higher than that of tobacco. And that is not, we have never seen that statistic before, where we have more kids in 12th grade abusing on a monthly basis marijuana than tobacco. Now, this indicator is worrisome in itself, but another even more worrisome indicator comes from a question from also the Monitoring the Future that aims to actually measure the number of kids that use marijuana regularly. And regularly means basically every single day. And this is an important indicator because it is likely that regular use is the one that's most harmful. And in the United States, in 2013, 6.5% of 12th graders said they use marijuana regularly. 6.5, and that's in school, which means that it's actually an underestimation. Because if you're a regular marijuana user, consistently, studies have shown you are much more likely to drop out of school. And this again highlights an indicator in my brain that we have a serious problem of abuse of marijuana among adolescents that we need to actually counteract. Well, what does marijuana do? Marijuana, as you know, some pretend that there's a controversy of whether marijuana is addictive or not. There's no controversy. Marijuana produces addiction.
It's addictive. You know, you can agree, you know, marijuana can cause addiction. We're not arguing that. But the thing is she's looking at addiction in children. We've all came to the conclusion a while ago, you know, people from Colorado and California came out and said if kids are exposed to marijuana, they're going to develop dependency. Just like kids exposed to alcohol.
Ritalin and alcohol.
And anything you give a kid, you know, a growing body, a growing mind, they're going to become attached, you know, physically, mentally, you know, everything. And marijuana is no different. Cannabis is no different. And you have to take that into consideration. You can't use that as facts to say that it just blatantly causes addiction. You know, you want to hear the addiction stats? Because I've got them, and they're actually hers. These are her stats. I've looked them up, and 316 million people live in the United States.
All right.
Okay. Roughly. You know, it changes every day. 111 million people, according to Dr. Nora Volkow, have been exposed to cannabis. And the definition of exposed is just to come into contact. So I'm assuming even someone that's been sitting in the backseat of a car, you know, we've all heard this, like, if someone peed a dirty test, they're like, oh, no, I don't smoke, but I've been around someone smoking the past month. So you're included. 111 million of 316, so 1/3 of the U.S. population has been exposed to cannabis. Of that 111 million, 9% become addicted.
So technically, like, roughly 10 million people.
Roughly 10 million people.
That's like, you know, and you still have 101 million
people that aren't. And this even accounts for children that she's done studies on, you know, and the whole thing comes to, yes, we know that children, it's not good for them, but there's certain cases like children with leukemia and children with, multiple sclerosis, epilepsy, all of those things. It's much better to have them.
Charlotte Fiji. Charlotte Fiji is one, like, she was literally the reason why they created Charlotte's Web. Yeah. You know, if you guys remember, Charlotte's Web is low in CBD, low in THC and high in CBD cannabis.
Now, whether or not that it's going to create dependencies on her and the way that it changes her brain, you know, it's better
400 seizures a
day, 400, you know,
400 seizures a day.
You know, what would you rather? So in that case, that's when children would be allowed to use medical cannabis. But other than that, 21 and up, you know, just like alcohol. And it seems to be working, you know, in the states it's legal, and I don't see people getting addicted to it like heroin and crack. You know, and these videos keep going into it. Now, we don't have like a whole bunch of videos more, but, you know, we're trying to keep this nice and short for everyone.
And one thing that I want to bring up, I want to bring this back up because I brought this before. The DEA made a study where they said that a lot of people were addicted to cannabis due to the fact that they would look at their stats in drug court. But here's the thing. I went to drug court. You know what I'm saying? And here's the choice that they give you. Either A, you go and spend some time in jail, or B, you take the drug court. Well, of course I'm going to say the drug court. I don't want to spend time in jail, so I'm going to take the drug court. But they take it as you being addicted and you got to go to all these stupid-ass classes. That doesn't do anything for me because while I'm going in there, I'm medicated. So while you telling me the cannabis is bad for me and trying to show me that I'm addicted and it's going to be creating this whole dependence, it's like, come on, man. You know what I'm saying? We're talking about that anything can affect the young mind. You know what I'm saying? We're talking about from Ritalin. You give a young kid, a 12-year-old, an 11-year-old, a 10-year-old, you start giving them Ritalin, you start giving them opiate, you start giving them all that, bro, they're going to become addicted. But here's the thing. Let's just keep rolling.
The concept that we've all discussed, marijuana is a gateway drug. And that is, indeed, if you look at the epidemiological data, has shown that people that become addicted to a wide variety of drugs, in many instances, start by taking marijuana. And this led to the concept of the gateway drug. Now, is this, do we have evidence or not? Well, what we do know is that the younger you start taking marijuana, even after you control for your genetics, as is shown by this study, which was done in twins, those twins that started smoking marijuana before age 17 had a much greater risk not just to becoming addicted to marijuana, because the other twin eventually did start taking to marijuana. They were recruited to be discordant, not in marijuana addiction, but at the age of initiation. And those that started before age 17 have a much greater risk of becoming addicted to a wide variety of drugs, indicating from epidemiological data and animal studies that indeed early exposure to marijuana may be associated with a greater risk to become addicted to other drugs.
Are you serious?
Like, is this girl for real? Like, here's one of the things that she says, man. First of all, you keep saying throughout everything that she said throughout the entire thing was kids. Kids. Not even kids of 18, kids of the age of 17.
And that's not just this video. Like, we did some research, and like it was on a few of them, and I had a hard time finding any kind of like substantial research from her. You know, she does have some other good stuff, but her total argument on cannabis sucks.
All right, and but here's one of the things that I am gonna say for this. You know what I'm saying? For argument's sake, I'm gonna say, okay, cannabis can create some dependency. You know what I'm saying? But let's just face it: the dependency and the side effects that cannabis gives you, they're so much lower than alcohol. If you were gonna stop alcohol, caffeine, if you were gonna stop addiction to caffeine, bro, there's some really crazy withdrawals. You know what I'm saying? It's just like, if you here to tell me that if a 17-year-old kid starts drinking Starbucks 24/7, but the age that he's 15, he's gonna create a coffee dependency, you know, a caffeine dependency. So it's like, your argument, like, you have a legitimate argument. I'm gonna give you that, doctor. But after that, and like what you're saying,
kids, your argument is great, but we've already proved that, and we've already established kids don't get cannabis.
You know what
it's
I'm
already
saying?
been established.
Like, yes,
this is irrelevant stuff, and just to tie this back into what this all means to the situation, this is where Michael Botticelli is getting all of his information, and this is who the government is leaning on, and this is because of you, all of you that voted for these people. These people were, cabinet members, whatever, but still, it's can be changed by you. This can continue because of you. This started because of you, and me and you, and we can change this.
And here you guys are gonna see the kind of powerful people that we have in our side now. You guys is gonna see why we keep saying that the time of cannabis has come.
This is bigger than what you think it is.
Exactly.
That, like, you think this is some kind of joke. Like, this is those things that you read about in history, and you're just like, damn, I wonder what that was like. You're living it, but I really want to watch Michael Botticelli bomb it right now.
Now, here he goes.
He just bombs it.
Now, you guys are about to see
Cohen pulls the shotgun out.
Yes, and you guys are going to see how Botticelli literally just drops the ball.
Oh, yeah.
Entirely. You guys are going to see the reason why this country and our political and our government and everything is the way it is, because dumb people like this, because we don't go out and vote, and we don't go out and put smart people into place. So then you have these corporations. You know what? I'm just gonna shut up, bro.
Yeah.
You guys are gonna see Botticelli. Here we go.
We are a science-based office and a policy-based office. And I think if you listen to Dr. Volka, who is not involved in a political discussion around substance use and marijuana, she will lay out for you the scientific evidence that.
Well, let me ask you this. You are prohibited by law from using any funds to study marijuana legalization for medicinal purposes or any other reason. You're the only office in the federal government that's restricted in that way, and you're required to oppose any scheduling of Schedule I substances, rescheduling like marijuana, that have been approved for medical purposes. Aren't you troubled by these constraints, and don't you think that your expertise should be allowed to be used and study science and contribute to a positive classification of drugs?
So I'm not familiar. Congress put that language in our reauthorization, and I'm actually not, I don't know the background of that.
Would you support legislation to allow you to participate and to voice your opinion and to use science as a basis for your determination?
Well, what I would do is support that federal agencies have the ability to do that. So
yours is prohibited by law. Should that restriction not be lifted?
Again, I think we'd have to have subsequent conversation in terms of.
You mean you think you should be muzzled?
I think that it's important that our office not involve itself in terms of given legislation or given activities. And I believe that was the genesis for that language, that the office not involve itself in state.
But the totality of the drug world, you need to participate. And if you realize that medical marijuana, as 20 states have found, can help people with cancer, with nausea, with those maybe glaucoma. I mean, Montel Williams apparently has some benefits from it. Lots of people do. That you should be able to participate and set our drug policy straight. Mm-hmm. Your job should be to have a sane drug policy, not to be muzzled and handcuffed.
Yeah. From again, my standpoint, I'm happy to engage in fuller conversation, is that has not handcuffed other offices and other federal agencies who are tasked with that work from investigating.
In 1971, Congress created a commission that was headed by Governor Schaefer of Pennsylvania to study federal marijuana policy. That commission came out in favor of decriminalization, but it wasn't put in place. That was 1971. Would you support a new commission to study federal marijuana policy?
So I haven't seen that legislation. I'd be happy to have further conversation.
Would you? It's a concept.
Again, I think we'd be happy to have a conversation in terms of what that might look like.
Thank you, sir, and I yield back the balance of it.
Well, it doesn't get no better than that.
It does not get anything better than that. Now check this out. This is a few things that I wanted to bring up to you guys real quick. When he says, by law, he is prohibited to study or to do any studies on medical cannabis. Now, he's the only office that is ruled by this. You know what I'm saying? They don't have no say or anything like that. You know what I'm saying? And when they told him that, they said that you are prohibited by law. How dare you to say, Mr. Botticelli, that you do not know the limitations of your position? How can you not know that you are not allowed to say or not say? But then after that, you move on to say that, you know what I'm saying? What is it? He says that that just for the simple fact that their office does not say anything or is not allowed to say anything, has not crippled any other offices to do their studies. So you just admitted the position that you have is useless. Because if we have other offices that can do what you can't do, then what do we have you here for, man? What is it exactly that you're doing? You can't answer a simple question that a kindergarten could tell you. You know what I'm saying? You don't even have to ask a kindergarten whether alcohol is more dangerous than cannabis, because you know what? He's literally going to tell you alcohol is dangerous. Why? Because he's probably having abused his dad that is beating his mom every time he has his little weekend cognacs. You see what I'm saying?
Allegedly.
So it's like it's ridiculous, man. You know what I'm saying? So
he made good points, and like I said, this is history. This is how it starts. Like, you haven't seen anything this exciting from government meetings in a while. Like last time you watched C-SPAN and saw stuff like this.
Exactly. Yeah.
So
totally
and it gets better because on this particular occasion, he got roasted by 3 people. You know, and we were going to cover all 3, but I like this guy, Mr. Blumenaar, member of the U.S. House of Representatives from Oregon's 3rd District. He was Portland City Commissioner, House of Representatives, 11th District. He's got history.
Yeah, he's just like Cohen.
And just like Cohen.
Top dog,
yeah, and they are perfect 1-2. Like, if that's the best way I can put it.
All right, you guys watch the one. Now watch
let's
the
get
two.
the one. Yeah.
Let's get the two in. Now watch this.
Mr. Botticelli, how many marijuana overdose deaths were there in the most recent year you have available?
To my knowledge, I don't know if there have been instances of specific overdose-related.
Well, no, you
deaths.
talked about marijuana deaths, and so I want to be clear. I'm trying to trap you.
No.
How many marijuana deaths have there been in the last 5 years?
So if you're referring to overdoses, I am not sure of those numbers. If you're referring to fatalities,
then I would like to have you supply us with how many overdose deaths there were, because I have heard from experts whose judgment I respect that they don't know of any. So that would be really important for you to provide, at least to me, if not to the committee.
I want to see him held up to that.
I mean, I swear to you now, I would love to see that he will pull out and then he say, how can you not know? It's statistics. It's statistics. Listen, it's been 0, Mr. Botticelli. I can answer you. All right? You don't need no studies. You don't need no... You just need history. You know what I'm saying? We're talking about you can go back to 8,000. You can go back to 1200 BC. And it will tell you 0 deaths has been okay, you know what? You do can actually kind of reach that point of overdose. And you will have to smoke 1,500 pounds of cannabis in 15 minutes to get a 50-50 chance that you might overdose yourself on cannabis. But
you have a better chance, the same chance of dying from Ebola,
yeah,
or 50%,
or getting struck by lightning. You know what I'm saying? Anyways, I just like how many deaths can you count?
And like Mr. Cohen,
I don't know the numbers. I don't know. How can you not know? It's like, what is your position then, Mr. Botticelli? Your position is fucking useless.
Censor that. No. But like Mr. Cohen said, if you want to take an accident, for example, and say the driver that is deceased was under the influence of cannabis, that if you looked on the same toxicology report, he'd probably have other drugs in his system as well. You know, you can't really link a death to cannabis, and especially an overdose death. You know what I mean? There's always, like, you know, I was high and maybe medicated and slipped off a roof.
Yeah.
You know what I mean?
There's been those.
But then there's people just slipping off roofs. You know what I mean? Sober. So, you know, you can't just say anything like that, you know, and even just
listen, there's this guy in Japan that died for studying too much. Now, this is no lie. You guys can research it. There was this guy who literally, I think he was studying like 18
you can die
or
from
19
drinking too much water.
Yes, you literally can drown yourself drinking so much water.
Yeah.
So anyways, listen, we just wanted to
just stress.
Keep watching.
What is more dangerous and addictive? Methamphetamines and cocaine or marijuana?
So, you know, I don't think anyone would dispute the fact that there's relative toxicity related to those drugs.
But I'm afraid what's more dangerous and what is more addictive? Cocaine and meth or marijuana? Pretty simple.
I think that conversation minimizes the harm.
No, I'm not trying to minimize the harm. I want to know which is more dangerous and addictive.
Again, I go back as
as
a public health person. You know, one of the things that we look at is not what's the relative risk of one drug.
Okay. Let me just say that I think that your equivocation right there, being unable to answer something clearly and definitively when there is unquestioned evidence to the contrary, is why young people don't believe the propaganda, why they think it's benign. If a professional like you cannot answer clearly that meth is more dangerous than marijuana, which every kid on the street knows, which every parent knows, if you can't answer that, maybe that's why we're failing to educate people about the dangers. I don't want kids smoking marijuana. I agree with the chairman. But if the deputy director of the Office of Drug Policy can't answer that question, how do you expect high school kids to take you seriously?
So, Representative, I didn't mean to be disrespectful, and I didn't mean to indicate that there is not different degrees of toxicity associated with different
I asked
drugs.
what was more dangerous. You couldn't answer it.
No.
And I just want to say that you, sir, represent what's part of the problem.
You, sir, you are what is part of the problem. I love that.
Yeah.
Like that should be a logo on a shirt.
Yeah.
Like we should make that a logo.
Yes, yeah.
You, sir,
are part of the
are a
problem.
representation of the problem. And that's so true, because
So true,
listen, man, the whole time they ask him a simple question: what's more dangerous, heroin, cocaine, or cannabis? And he just totally avoids the questions. You know what I'm saying? And
Because he can't answer it. There's proof. Anyone can answer that question and would try to give you an answer. He obviously cannot give an answer. And this is a prime example of why it's up to you, me, to change this. Because this is what has been started since back in the 30s.
yeah, and here's another thing that he brings up, man. You know what I'm saying? He says it's like that's the reason why young people don't believe in you, because you, a professional like you, cannot answer a simple question as what's more dangerous. It's like, you know what I'm saying? And that's another thing right there. That's the problem with the education that we have with the kids, because we are so scared, I guess, you know what I'm saying? Because the government have played these mind games for 70 years. The cannabis is so dangerous that we're willing to compare it to methamphetamine, heroin, and all these crazy drugs. And then when the kids get exposed to it, they see that is not what, you know what I'm saying, what the parents been saying, what the government has been saying. So that's what they decide to try all the drugs, because they, you know what I'm saying? They say, okay, well, cool, you know what I'm saying?
Well, not that,
I
but
get medicated
but
and nothing
think
really
about
happened.
when have you been to a dispensary in Colorado and seen cannabis, crack? Nowhere. How many times do you go to the caserío down the street and you walk in there, cannabis, cocaine, crack, heroin, and the guy's like, "What did you want?"
And it's like, that's the whole thing, and that's what like, it's not that the cannabis opens us a new door. It's like you misleading people to think that cannabis is such a, like, you know what I'm saying? And stop with the lies and start really educating people in the real drugs, prescription drugs, like heroin, crack cocaine, all these crazy drugs that are out there. That's what you guys need to do.
I want to make a bet. I want to make a bet on the future that as soon as cannabis is legalized, just about everything else is gonna fall off.
Well, you gotta
America.
think. Listen, the next episode is gonna be. Obama is gonna pass a bill, and hopefully, you know, if this bill passes, it will be not exactly a nationwide legalization, but
it gets the federal government off of everything.
We'll explain it more.
It's awesome.
You know what I'm saying?
We're gonna talk about it
again. Well, thank you guys so much again for
No, we got more. Whoa, man, he's not done. You thought he was done? You thought he was done?
I thought he was done.
Oh no, let's watch him wipe the floor. He's gonna take out the trash now. So let's get to it.
Let me go a little further.
So, sorry, that's
Let's
exactly
talk
not
about
what I'm saying.
What kills more people, tobacco or marijuana?
There's been a fair amount of tobacco-associated deaths. My challenge, and the reason I'm hesitating about answering the questions as it relates to relative risk, is I think many times that conversation gets distorted, that there's no risk, that there's...
I'm not trying to trap you.
No. But this is why, Representative, I don't want to be disrespectful.
Let me suggest that your inability to answer me whether tobacco or marijuana is more dangerous, again, is part of the problem. Mr. Connolly documented very clearly that we have been able to drop dramatically tobacco use. And it kills more people than marijuana, if you don't know that. But we've been able to drop that without locking people up, without arresting. I think this administration has seen 3 to 4 million people arrested for marijuana since it's been in office. And yet we've been able to drop tobacco use without being coercive. We've been using fact-based advertising, and we've focused our efforts on things that matter rather than things that don't work.
Focus on things that matter.
Focus on things that matter. See, here's one of the things that, you know what I'm saying, and this is how we're gonna, you know what I'm saying, break this down right here. The inability to answer a simple question as whether tobacco is more dangerous than cannabis, again, shows the problem of the reason why no kids believe in everything that you say, because you come out straight up with lies and you can answer the simple fact. Now, another thing, it says we spend a lot of people, you know, locking up people for cannabis. Now, when he talks about when they brought down the tobacco use, we were talking about this earlier, and here's one of the ways that they do it: large amounts of advertising, true facts about cigarettes, you know what I'm saying, education, focus. And just like he said, he says they focus all the efforts, budget, information, everything.
Well, tobacco has been facts. Matter. It's just hard, honest facts.
Yeah.
Tobacco gives you cancer. Tobacco does this. If there was that about cannabis, I'd probably be against cannabis, but there isn't. There's not. There's not one thing. And in fact, cannabis helps cure cancer. Even, cannabis helps pain.
Think about
cannabis
it like
helps this.
Think about it like this, man. If we actually focus all our time and effort
on the
actually put in our all right, real quick. Tobacco use, we saw a lot of propaganda. Watch this. We saw a lot of propaganda on TVs, you know what I'm saying, which a lot of people watch TV. So if you're constantly seeing that on TV, of course it's going to do an impact on yourself. Now imagine if we spend the same amount of money that we spend on against cannabis. We're using it in education with cannabis, and we're using education in other harder drugs. Imagine if we start putting facts about heroin. Imagine if we start putting facts about cocaine. Imagine if we start putting facts about prescription pills. Imagine if we start doing all this propaganda on all TV, national TVs and everything. Bro, I guarantee you that we bring down the abuse, we bring down the curiosity, we bring down. We gotta teach our kids that, man. We can't be lying to them. We've been lying them from 70 years, and it's turning out what? The more arrest people, you know what I'm saying, like #1 country to arrest the more my citizens by capita, you know what I'm saying, the worst educational programs. Why? Because we decided to lie. The government rather have you lie and just believe their lies, because they don't want you to think for yourself. Because if you think for yourself, you're the biggest threat to them. If you're self-sufficient, you're the biggest threat to them.
We've turned ourselves into our own enemy.
You know what I'm saying?
You know?
It's straight up, bro. You said it perfectly, man. You know what I'm saying? And you know, it's just ridiculous, man. You know what I'm saying? But all right, and finally now, ladies and gentlemen, this is it.
We've reached it.
Thank you so much again for your support and for keep watching. Just keep watching.
If you watched it till here, we owe you something.
And this is what we do. We do it for you. Thank you so much. Again, this is your boy OG Dre and your boy Cisco. We're signing out.